for joining us today, Dr. Barnes.
Glad to be here.
So let's get started. What role does the urologist play in men's health?
The urologist plays quite a pivotal role in men's health in that I would say at least 60% of our patients happen to be males. We treat primarily male-related issues, and when it comes to men's health, we particularly focus on things such as prostate health, prostate cancer, erectile dysfunction, testosterone deficiencies. All of those fall under our banner. And when we look at each of those individually, they impact other areas of men's health.
Excellent. So what should men know about prostate health?
Well, prostate health encompasses two sides, both the cancerous side with prostate cancer and the non-cancerous issues of benign prostatic hyperplasia. In addition, men also tend to get prostate infections, etc. But when we talk about prostate cancer is the #1 solid tumor malignancy in men in America. Approximately 11% of men in their lifetimes will develop prostate cancer. So we need to look at who are in the high-risk groups and what are the ages for screening so that we can detect it in men who have it at an early stage, so we have our greatest impact and our greatest chance for cure.
Excellent. When do you recommend men to get screened?
Well, the American Urological Association, or the AUA, which is our primary professional organization, recommends screening in high-risk patients, generally starting at about age 40 to 45. And those groups entail men who have a primary family history of prostate cancer, fathers, brothers, uncles, and even extending out now to women in their families who have had breast cancer, ovarian cancer, or any pancreatic cancer. We actually have found an association with the BRCA genes, both BRCA and BRCA2, with men with prostate cancer. In the men who have low risk, all non-African American men and men who don't have a family history, then we start looking at ages 55 to 70 as a primary time for annual prostate cancer screening. The thing we use primarily for screening is the PSA test. PSA test is a simple test that's performed as a blood draw, and it is a protein that is made specifically by the prostate and no other organ. So as a screening tool, it tends to be highly sensitive. But an annual PSA test in those men in those age groups is very beneficial for early detection.
So do they go to a urologist to get this test done, or should they consult with a PCP? What process do they use to get screened?
Well, that's an interesting question. And it's interesting in the fact that they can get it drawn and ordered by any doctor, primarily by their PCPs. Unfortunately, there's been somewhat of a disconnect in prostate cancer screening with the Family Practice Association versus the American Urological Association, et cetera. There was a movement in 2014 by the U.S. Preventive Health Services to discontinue screening for some of the more common diseases such as prostate cancer and breast cancer. Our organization feels that these men should have screening if they're particularly in the high-risk group and all low risk between 55 and 70. However, men should take matters in their own hand and have a serious, informed discussion with their primary care doctors about the rationale of screening for them. At the end of the day, the test is a very cheap test, less than $100, to detect a disease that is highly prevalent and that can be impacted very positively by early diagnosis.
So when should someone seek help for everybody's favorite topic, erectile dysfunction?
The morning after. So the way I look at this, Garrett, is in a happy relationship, there are many different factors that add up to happiness. And one of those factors for most couples happens to be intimacy. And when intimacy becomes an issue, it generally spreads into other areas of the relationship, causing stress fractures. So if there is an issue of erectile dysfunction, I think these men should reach out and seek help. On the surface, a lot of people will think, well, this may be secondary to stress, it may be secondary to my relationship, but oftentimes there may be an associated underlying medical problem that needs to be addressed, whether it's hypertension, hyperlipidemia, heart issues, high blood pressure, diabetes, many of which may be undiagnosed until they present with a complaint of erectile dysfunction. But I think it's important early on for both the relationship issues, the psychological and social issues, and for a man's overall health to seek out help early when erectile dysfunction strikes.
Very good to know. Low testosterone treatment seems to be a hot topic lately. How do you know if you have an issue?
Again, a very good question. As a urologist, we look for men who are symptomatic with low T or low testosterone. Our organization has actually established guidelines recently on how we should approach the low T patient. Merely having a low testosterone, which by national standards is a level of less than 300 nanograms per deciliter. Labs values may go a little lower than that, but the FDA and the AUA recognizes a level of 300. But merely having a testosterone below that level does not necessarily mean that one should have treatment. We also look for men to be symptomatic. So are they anemic? Or are they having signs of osteopenia or bone loss? Or are they having severe depression that is not resolving with standard medication? Or are they having lack of libido or decreased sex drive? Or are they having erectile dysfunction? Or are they having fatigue? Any or all of a constellation of those should then be considered for addressing. But unfortunately, we have a situation where a lot of the medical professionals have been taken out of the loop, and treating low T has become sort of a sexy thing. And that has become more of a income-driven or profit-driven venture for a lot of places. Coming to a medical professional such as a urologist or a family practice doc or your internist, I think is the wisest thing to do, because our interest is treating the patient and identifying any other underlying health issues that may be contributing. In addition, we have the ability to give the full gamut of care. A lot of patients who go to for-profit low T centers that go by many different names are going to be given one choice of treatment, injections. And those patients have to come in every week and get their injections. For the urologists, for the family practice docs, for the internists, we offer every different modality, whether it's a gel, whether it's an injection, and in our practice, whether it's compounded testosterone pellets. We provide the patients with convenience and low cost in treating this. And it's really, really important not only to diagnose it accurately, but to monitor these patients as we go forward. And that's one thing that we do on a regular basis.
Very good. So what are some other common men's health issues that you see in your clinic?
Well, men are impacted by other issues such as infertility. I manage most of the infertility in our practice, but for a couple that's really trying to conceive and have had difficulty in doing so, generally on the order of greater than 12 to 18 months. A lot of those couples are stressed, and it causes stress in the marriage. And we do infertility evaluations and treatment for the male factor, but we treat those patients as couples. Men are also impacted by other common medical problems such as stone disease. We unfortunately live in one of the 3 geographic stone belts in the U.S. And so our risk for having stones in this area is higher than if you lived in New York or Minnesota or even California. And stones, as most patients will describe, a stone episode can be the worst pain you can experience, but live to talk about. So being able to focus on those things also helps us. Men also have a lot of voiding dysfunction or difficulty urinating, secondary to benign enlargement of the prostate. And we offer every modality to treat that, whether it's medication, minimally invasive procedures such as microwave, minimally invasive surgical procedures such as prostatic urolift, green light laser, and TURP. Those men have significant stress in their life because when you have voiding dysfunction, it pretty much determines what you do, when you do it, and where can you go. I mean, you want to go to your kid's baseball game, but you know that the bathroom is going to be 3 fields away. And your problem is when the urge hits you, you can't make it in time. We can manage those patients, and we manage those patients well, whether it's due to the prostate, whether it's due to neurologic illness, etc. So we have the ability to impact men's health and improve their quality of life in dealing with these problems on a daily basis.
Excellent. Well, Dr. Barnes, thank you so much for joining us today. We appreciate you all joining us today, too. For more information, please go to memorialhermann.org.